We're back with a controversial question tonight. Can you be diagnosed with grief? And more than that, should you be given a pill for it? Scientists are debating whether to classify the pain we feel after a loved one dies as a disorder and something that could be treated with medication. This as antidepressant use in the U.S. has jumped almost 400% in the last 3-year period. Our report from NBC's Ann Thompson.
Death is an inevitable part of life, and so is the pain that follows. But is it a disorder? Grief would be labeled a mental disorder under a proposed change in the diagnostic manual for the American Psychiatric Association.
The reason to do that is so that clinicians can consider the possibility of whether to treat a major depression in someone who's recently bereaved.
Critics say the controversial proposal would stigmatize what is part of the normal human condition.
We are, in fact, making it so that unhappiness seems to be something wrong with you rather than a signal that you should do better in your life or retool your life somehow.
That's a great shot.
Andrea and Keith Rieger have known that gut-wrenching pain for almost 3 years after losing their 22-year-old daughter Stephanie to colon cancer.
I miss her laugh, her contagious laugh.
They say they have reclaimed their lives, but not filled the emptiness left by Stephanie's death.
Your mind kind of doesn't allow you to fully accept the impact.
Many in the psychiatric world fear the new label would lead to a dramatic increase in the use of antidepressants, already taken by 1 in 10 Americans, an $11 billion a year business.
If you classify grief as a disorder, it becomes a target for treatment and for especially medication. It will become a target for drug development.
Supporters say drug therapy should not be an obstacle or the only answer.
It's not an essential, but it is one of the tools in our toolbox for depression. There are others. There are very good psychotherapies for depression.
A difficult subject for the pain we will all feel and the doctors who want to help. Ann Thompson, NBC News, New York.